Greetings. This is Dr. Dan Grobe with the Pediatric Orthodontist with our first Mechanics Minute. Because so many treatments for pediatric patients involve expansion, I thought we should dispel some common misconceptions during this first presentation. In the past, I was trained to expand the maxilla in the presence of a crossbite. With publications and research utilizing CBCT, such as this from Matthew Miner, appearing in the AJODO, we have now modified this common belief. Miner's study analyzed the width of the upper and lower jaws in the sagittal and transverse dimension of 241 patients, concluding that there are 3 possible configurations identified as problematic. Notice how all of these situations, when viewed intraorally, would not be identified as a crossbite. The conclusion was that patients without crossbites can have significant discrepancies that might warrant treatment. With that, I introduce our first patient without a crossbite, but a narrow upper jaw. This patient was a thumbsucker, which contributed to the malocclusion and was edge-to-edge class 2. An RPE was used with full orthodontic appliances to widen, get corresponding mandibular growth, and finish in a class 1 occlusion. At initial presentation, the tip of the tongue is low and posterior. The minimum cross-section area of the oropharynx is 61 square millimeters. The transverse dimension across the palate was only 28 millimeters, while 36 is desired. Following expansion, the smile is broad and protrusion is reduced. The arch form is changed from a V shape to a U shape in the maxilla, allowing for forward positioning and growth of the mandible. The sagittal view shows how the profile has straightened and the incisors are now aesthetically upright. At conclusion, the minimum cross-section area is now 126 square millimeters and the tongue is positioned on the roof of the mouth. The distance across the palate is now 37 millimeters with more upright posterior teeth. The adenoids have been reduced. I hope you enjoyed this topic. Please share this first Mechanics Minute with a friend and be sure to like this post. Thank you.